Hi everyone and welcome to a new video. Today we're going to look at the importance of range of motion at our joints, specifically the ankle. Now the ankle is responsible for dorsiflexion, which is essentially bringing your toes up towards your shins like so, and plantarflexion, which is pointing our toes downwards like that. Now usually it's the dorsiflexion which is quite limited in a lot of people. Most people don't seem to have too much of a problem with plantarflexion. It's more the tightness in the calves or potentially a restriction in the ankle joint which makes dorsiflexion quite limited. And therefore we're going to focus on dorsiflexion a little bit more and go through why it's important to have good range in this movement, and if we don't have good movement, then what we can do in order to combat it. So why is dorsiflexion important? Well, essentially it's important for a nice efficient running gait. So when we're moving forwards in this sagittal plane, which is forward and back motion, we need to essentially transfer our weight that way because that's where we want to go when we're running. However, if we don't have this range through our ankle joint, then essentially it's acting like a sort of a sagittal plane block. You might notice that you're overpronating quite a bit if you've got this sagittal plane block. And as I mentioned in a recent video, overpronation is not necessarily a problem, but it can be an indication of an issue elsewhere. So if we get to this point and we can't transfer our weight even more, then that's going to limit this nice triple extension as we come through, and we then go from this dorsiflex position to our plantarflex position in order to create this range of motion. So it's going to shorten our stride at the back, it's going to inhibit our glute activation, and therefore it's going to hinder our ability to transfer our weight forwards, and therefore our body is essentially going to be sort of fighting itself and overcoming its own deficits. The other reason why it's important is because muscles are essentially like elastic bands, so the more you stretch them, the more energy release you're going to have. So if you only stretch an elastic band a little bit and then let go, it's not going to contract very hard. Whereas if you lengthen it to its maximum and then let go, it's going to snap back really with a lot of force. And that's why dorsiflexion is important, because the more stretch we can get through our muscle with this dorsiflexion range, the more elastic energy return we're going to have when we start to power through our triple extension, when of course we plantarflex the foot. So it's very important in terms of our power also. So how do we test whether or not we've got good range of motion in the ankle? Well, there's a test that you've probably heard of. It's called the Lunge Test, or some people just know it as the knee to wall test. So we just need a piece of wall. What we're going to do is we're going to start with our toes just very close to the wall to begin with. And the aim is to be able to touch the wall with your knee without the heel coming up like so, okay? And then obviously that will be a pass. So once you pass, then you can just move back a little bit, just in very, very small increments. Some people try and go back really far, but then that just makes the test really difficult. So just go back very, very gradually. So that's a pass, move back again, that's a pass. So then you keep going until that heel starts to come up. So obviously you can see here my heel's starting to come up, so that will be a failed test. So I'll move forward and find that maximum point where I can get that light touch of the knee on the wall. So it's about here, I would say, is my maximum dorsiflexion range. You would then obviously measure that as well. Now, one thing we need to be careful of with this test is that we're not collapsing in with our knee or pronating our foot inwards in order to get the knee to the wall, okay? Because as I mentioned earlier, overpronation might be a sign that you've got tight calf muscles and that you've got that sort of sagittal plane block. So then if we're reliant on that in order to get to the wall, then it's not really a true indicator of how much range is available at that ankle joint. So just try and maintain good knee alignment, whereby your knee is tracking over sort of the middle to the outside of your foot, like so. Okay, and then obviously you would compare the two to see if one's tighter than the other as well. So what is the normative data? So how far should we get to? I mean, what indicates a tight calf muscle or an ankle joint restriction? Well, usually as a very, very rough guide, we look at around 10 centimetres from the wall. So our toes will be 10 centimetres away or about 4 inches. However, I usually am quite tentative with saying that because it does depend upon a lot of factors, depends upon the individual. So for instance, what footwear you typically use, because if you wear footwear, it's going to raise your foot up like so, because most running shoes of course have a heel to toe offset, so that's going to help you to achieve that sort of golden 10 centimetres. So therefore you could probably argue that, you know, it's more specific to the activity if you're wearing running shoes while doing that test. But also the activity does of course come into it as well, so what sport you do. So if you are a runner, you're probably likely to need a lot more range of dorsiflexion than someone who is quite sedentary or maybe just does a bit of walking around. They're not going to have to stride out as much and have this nice triple extension, so they're not going to require as much dorsiflexion of the foot either. So what do we do if we do have that tight calf muscle or joint restriction? How can we improve it? Well, first of all, we need to find out specifically what is causing the lack of dorsiflexion. So if you get to your limit and you can feel it really, really stretching in the calf muscles, particularly the lower calf where that soleus is located, then it's a sign that you've got a soft tissue tightness, so you've got inflexible calves essentially. If, however, you can sort of feel almost like a pinching in the front of the ankle joint just here, then it's a sign that you've probably got a tightness in the joint. So you've got a joint restriction that needs obviously to be corrected. So now I'm going to go through some exercises of how you can alleviate both of those things. If the results from our lunge test shows us that we've got a lot of tightness in our calves, then obviously the course of action will be to increase the flexibility of those muscles. So I'm going to give you a couple of stretches in order to do just that. So the first one is going to focus on the soleus muscle, which is the deeper of the main calf muscles. So essentially what we're going to do is we're going to sort of kneel down like so, and the foot that we want to stretch is going to be just behind the knee of the other side. Okay, so the knee that we're not stretching is going to be in contact with the floor, and then the toes of the side that we're going to stretch, so I'm going to stretch my right leg, are just going to be located a few inches behind that knee. So essentially our heel should be off the floor like so. And then what we're going to do, we're just going to place a bit of pressure by leaning on that knee, and we should be able to feel a stretch of our lower calf muscle into that soleus. If you can feel it sort of pinching across the joint, just here, it might also be a sign that you've got a joint restriction, which we're going to cover in a minute. So as it's a static stretch, we want to hold this stance for at least a minute in order to gain enough flexibility. And then of course we'll repeat on the other side. And then the other stretch is going to target the surface muscle, so the gastrocnemius of the calf. Now, a limitation of the lunge test is that it won't pick up any gastrocnemius tightness, because of course when we're doing the lunge test our knee is always bent, which means that the surface muscle, the gastrocnemius, which passes over the knee and attaches just above, that's going to be relaxed in this position. So it's only going to really test the soleus muscle, which attaches beneath the knee. However, you might still have tightness in the calves. You might know that you have tightness in the gastroc that needs to be stretched out. And of course, by doing this stretch, we can use it almost as a test in itself to determine whether or not we've got that inflexibility. So essentially, what we're going to do is we want to stretch a muscle. So this time our leg is going to be straight behind us. So we're not going to have any sort of bend in it because we want to lengthen out that gastrocnemius muscle. So it's a classic stretch where you just put your hands on the wall and you're just gently pushing against the wall while the leg is straight behind you. And then of course we can move further back as it releases off as well, just very gently. So again, because it's a static stretch, we're going to hold for at least a minute. The other scenario which could be causing a lack of dorsiflexion range is a restriction in the ankle joint itself. Now this often happens following an injury, for example an ankle sprain. So essentially, if we think about the mechanics of the foot, when we dorsiflex, we've obviously got the bones of our lower leg, our tibia and fibula, translating forwards, like so. But at the same time, in order to allow that dorsiflexion movement, we have the talus, which is a bone in the ankle joint, translating backwards as well. So essentially, we've got this bit moving forwards, this bit moving backwards as well. Okay, but quite often the talus can become a bit jammed if there's a restriction in the joint, and that translation backwards doesn't quite work as effectively as it should. So when we translate forwards with the knee and our tibia comes forward, then it sort of pinches upon the talus, which is why you get that sort of discomfort at the front of the joint just here. So therefore, we can do an exercise to try and remedy that. So we want a resistance band. So we want quite a really thick resistance band like so. And we want a lot of tension in it as well. We're going to loop it around the foot. We're going to elevate the foot slightly, so we've got a pulling sort of slightly diagonally downwards. And we're going to position the band so it just sits in the gap where that talus is located. Now, a good way to locate the proper area is if we find these two bony landmarks on either side of the foot. We've got the medial malleolus, the bony prominence on the inside, and the lateral malleolus just here. So the band essentially wants to sit just beneath those two structures. And then, as I say, we need quite a lot of tension in the band in order to achieve this. And then we're just going to do our forward and back movements like so. And as we come forward, assuming there's enough tension in the band and assuming that you do have that joint restriction, you should feel like it's sort of pulling that talus back slightly. And after a while, if we do this exercise enough, then you'll feel an improvement as that talus starts to sit back into that position it should be in. Okay, so we just want some gentle movements, and then of course we can increase the tension in the band by moving the foot forwards as well. So I would advise probably a good sort of 10 to 12 of these movements at a time, like so. And then of course we'll repeat on the other side if we've also got a joint restriction there as well.